The clinical approach to patients with icterus, also known as jaundice. The overview: jaundice is yellow staining from excessive bilirubin. Types are prehepatic, hepatic, and posthepatic. Prehepatic is from excess red blood cell breakdown, hepatic is from impaired bilirubin processing, and posthepatic is from an obstructive bile excretion. The causes and signs: for prehepatic icterus, the causes are babesia, immune-mediated hemolytic anemia, toxins in the case of onions and paracetamol, and Mycoplasma haemophilus. Signs are dark feces, also known as hypercholic feces. Lab findings: we can find decreased hematocrit, increased reticulocytes, an increase of bilirubin 1 and bilirubin 2, and an increase of urinary urobilinogen. In hepatic icterus, it's caused by hepatitis or cholangiohepatitis or infections or neoplasia. The signs are partial stercobilin in the case of hypercholic feces, and in the lab findings you can see an increase of ALT, AST, GTT, and bilirubin. In the case of posthepatic icterus, the causes are gallstones, pancreatitis, and obstructions. In the signs we can see grey feces. This is due to absence of stercobilin. Lab findings: we can see an increase of bilirubin 2, an increase of ALP, an increase of GGT. We see no urobilinogen and no fecal stercobilin. To sum up the laboratory differences, in prehepatic you can see a great increase in bilirubin 1 and an increase in bilirubin 2 and a very big increase in urobilinogen. In hepatic you can only see a mild increase in bilirubin 1 and bilirubin 2 and a decrease in urobilinogen. And in posthepatic, bilirubin stays at 1 and you see a massive increase in bilirubin 2 and no urobilinogen. Prehepatic has lots of stercobilin, which leads to dark feces, and posthepatic leads to no stercobilin, which leads to grey feces. In hepatic you can see a decrease in PCV and an increase in reticulocytes. In hepatic you can see an increase in ALT and AST, and in posthepatic you can see an increase in GGT. From a clinical approach to assess it, you look at the history and physical exam, see if there's any anemia, hepatomegaly, or biliary obstruction. Imaging: use ultrasound to look at the liver, pancreas, and bile ducts. Treatment: for supportive care, do IV fluids, electrolytes, and antiemetics, and gastroprotectants. And treat the underlying causes. For prehepatic, manage any hemolysis, for example, immunosuppression for immune-mediated hemolytic anemia. In the case of hepatic icterus, treat any infections in the case of cholangiohepatitis. For posthepatic icterus, relieve the obstruction. You can have a surgery for gallstones. Also help treatment with giving vitamin E, urodeoxycholic acid, give vitamin K and plasma in the case of coagulopathies. Cat's bilirubinuria is always pathological. There's no renal threshold. See the severity. If there's a lab increase, it can be mild. If there's yellow plasma, it's moderate. And if there's visible jaundice, it's severe.